Florida lawmakers have passed the nation's first bill requiring all high school student athletes to take precautionary heart tests. Athletes would undergo an electrocardiogram, also known as an ECG or EKG. It's a non-invasive test used to evaluate the health of a person's heart by recording its electrical signals, according to the Mayo Clinic. These tests can help diagnose heart attacks or irregular heartbeats. They would become mandatory for all Florida high school athletes starting in the 2026 to 2027 school year. But the bill must first be signed into law by Florida Governor Ron DeSantis. CBS News medical contributor Dr. Céline Gounder joins us now. She's the editor-at-large for public health at KFF Health News. So, doctor, what is your take on this mandatory EKG test for student athletes?
Honestly, it's a very well-intentioned approach to reducing sudden cardiac death among student athletes, but it is misguided. The problem with these kinds of EKGs in highly trained athletes is they're very difficult to interpret. You need to be a cardiologist who understands sports cardiology, which is not the normal cardiologist. And so you're going to end up with a lot of false positives, too many people being picked up as having abnormalities who don't actually have any issues at all.
Is the idea that maybe like local school districts can't afford to have a specialized sports cardiologist as part of this bill? It doesn't allocate that funding?
Well, sure. And if you look at professional teams, college sports teams, they might have that kind of support, but you're not going to have that for your local high school team.
The goal here is to save lives. Couldn't screening help prevent tragedies?
Well, we have not seen data that supports that doing more EKG testing will actually reduce sudden cardiac death. We know that if you have AEDs on site, so those are the automatic defibrillators, if people have been trained in CPR, if there are protocols for what to do if somebody has an incident, that we know actually makes a difference. But having a broad screening program with EKGs for everybody, that's unlikely to make a big dent here.
What would a good approach look like?
Well, being much more targeted in your EKG screening. So if somebody has symptoms, if somebody has a family history.
What would be some symptoms?
Irregular heartbeat, for example, maybe shortness of breath, chest tightness, those kinds of things. That would be a more targeted way of doing things, and you would really be identifying the kids who have problems, not just everybody who is a highly trained athlete and the cardiologist doesn't know what to do with it.
You mentioned the likelihood of additional false positives. What effect does that have on the person?
Well, imagine you're a student athlete, you're thinking of going professional maybe one day, or you're really counting on that college scholarship, and now you're being told you may not be able to play high school sports, which is what gets you there, right? And then you're looking at having to go to a specialized cardiologist for more testing, maybe an MRI. Not everybody has health insurance. Not everybody can afford all of that. And so you're basically taking all these kids out of sports, which might be their pathway to the future, creating a lot of anxiety for no good reason at all.
All right, Dr. Céline Gounder, thank you.